In the last lesson, we introduced the concept of fluid balance and discussed where fluid is located in the body. We learned that fluid exists both inside of the cells and outside of the cells in different compartments. But fluid in the body is not static. It is constantly moving between these compartments. So understanding how and why fluid moves is essential for recognizing conditions like dehydration, edema, and electrolyte imbalances. To understand these fluid shifts, we first need to understand a key process that drives water movement in the body. So let's start with the simple question. What is osmosis? Osmosis is the movement of water across a semipermeable membrane. This process determines where fluid shifts in the body. A semipermeable membrane allows some things to pass through, but not others. In the body, cell membranes allow water to move freely. Let's see a visual of this. In the middle of our slide, we have a semi-permeable membrane with holes that allow some things to go in and out freely. On the left-hand side of the screen, we have low solute, or low concentration. Very little molecules that we would consider our concentration among many droplets of water. On the right side, we have high solute, or a higher concentration. So we'll have many molecules of concentration with very little water. In order to create a balance, water needs to move from the lower concentration over to the higher concentration to balance out the area in the body. Water moves towards lower concentration to higher concentration. If you can remember one sentence from this lesson, remember this: water follows solute. Now let's talk about tonicity, or tonic, or what we'll refer to this as the concentration of solutes in our fluid. There are three types of fluids: hypotonic, hypo meaning less than, so a less than amount of tonicity or concentration of solutes; isotonic, iso meaning equal, so an equal amount of tonicity; and then hypertonic, hyper meaning high or higher than tonicity, or a greater number of tonicity or concentration of solutes. Let's start with the easiest one first, isotonic. As you can see, the cell to the left of the screen and the outside of the cell have about the same amount of water molecules. Isotonic is going to be equal concentration. So there should be an equal amount of molecules and concentration both on the inside of the cell and the outside of the cell. In an isotonic solution, solute concentration is equal on both sides. So this means that water moves equally in both directions, and the cell itself will remain the same size, and that is key to remember. With isotonic solutions, because of the equal concentration, the cells themselves will not change size. Water comes and goes freely. In hypotonic solution, hypotonicity means less concentration. So on the outside of the cell, we are going to see the low solute, or the low concentration of molecules, compared to what is on the inside of the cell. The inside of the cell will have the higher concentration of these molecules, or solutes. So in a hypotonic environment, the outside has less solute than the inside of the cell. Water will need to move inside of the cell to balance this out. As you noticed, when water moves into the cell grows larger or starts to swell. And the last IV solution is hypertonic. Hyper meaning more or higher than, so more concentration of solutes. So if we look on the outside of the cell, we see a lot more solute molecules. This is our high solute area. And on the inside of the cell, we have a lesser amount. So this is going to be the low solute. So in a hypertonic environment, the outside has more solute or concentration. Therefore, water needs to leave the cell, go to the outside of the cell to balance it out. You'll notice that as water leaves the cell, that the cell started to shrink or get smaller. So why should nurses care about fluid balance and osmosis? Well, when patients develop edema, they can have fluid shifts within different compartments of their body. Edema can lead to many other complications, so we need to be able to assess this quickly in the patients. Dehydration affects the body cells, and this affects fluid balance very directly. IV fluids can change tonicity and can change how the body cells are accepting or rejecting fluid. So we need to be aware of how this works for the patient, as well as for future treatments if this is even an acceptable form of an IV fluid to give. And lastly, electrolytes do influence water movement, and that'll be a whole other lesson later on. Understanding fluid shifts allows you to predict what the body will do with edema, dehydration, IV fluids, and electrolytes. Let's do a review question. If a cell is placed in a hypertonic solution, what happens to that cell? Does the cell start to swell up or grow? Or does the cell shrink and get smaller? All right, so let's think about this. If a cell is placed in a hypertonic solution, that means that lots of tonicity or lots of concentration is going to be found outside of that cell. When the high concentration is on the outside of that cell, the body is going to try to balance it out. To balance it out, it's going to push water from the inside of the cell out. And if the water moves from inside of the cell and goes outwards, that cell is going to shrink. If a solution has a lower solute concentration than the cell, it is called hypotonic or hypertonic. So if a solution has a lower solute concentration than the cell, this means that the outside of the cell is going to have a lesser amount of molecules or concentration of solutes. So what would this be called if it's a lesser amount of solutes? Well, it's going to be called hypotonic solutions.